guys, it's Dr. Raz from the Center for Total Back Care, and I'm here today to talk to you a little bit about telehealth. You may have heard this word out and about now with the COVID-19 outbreak. Telehealth refers to the ability of the healthcare provider to provide healthcare to the patient in a setting other than the clinic, like their home, for example, so that they can stay safe. You may be asking, is telehealth covered? And yes, telehealth is covered. Governor Doug Ducey mandated at the start of this emergency that Arizona state insurers would pay and waive the copay for the patient, so it is covered. And now you may be asking, well, what does that telehealth entail? What do I do with that? Well, it's basically the same type of visit as you would have in the clinic. It's just a little different because obviously there's no hands-on treatment, but we can evaluate your neck pain, your back pain, existing pain that's been going on that I've treated you for, or even new pain that's set in from not being able to be seen in the clinic. I can do a quick assessment of any of that that's going on. And then from there, I can prescribe you exercises that I can send to you via email that would be appropriate for you. Or we can talk about your workstation setup. A lot of people are working from home, so I can evaluate that and make sure that it's the best it can possibly be. But if you want more detail, we have a video here with a patient of mine, just to give you an idea of what that actually looks like. So, hi Zach, how you doing? I haven't seen you in a while.
Yeah, I'm doing good.
How's your back feeling?
So it was feeling better before this happened, but ever since I've been working from home, it feels like it's kind of been getting a little bit worse. And then actually just today, my neck started to bother me as well.
Okay. Well, maybe I can take a look and see kind of what your workstation looks like. Since you've had to work from home, maybe there's some adjustments we can make to that to make it better on your back and your neck.
Yeah. Yeah,
Okay.
let me show you it.
Okay.
So this is like mainly my laptop I'm working on, and then I've kind of just had to make shift with this like fluffy pillow to sit on. Just it feels like it's helps a little bit.
Okay. So one thing just by looking at that I would change is possibly getting some lumbar support. So you can either, look and see if there's something on Amazon that you like, or you can take a bath towel and roll that up and kind of stick it behind where you have the curvature in your lumbar spine to help with that. Um, is there a way that I can see you sitting at the desk?
Um, yeah,
Is that a possibility?
let me see if I can set this up. This is me when I'm sitting at my desk. Usually I try to kind of position my laptop to look up, but it's kind of hard. So it feels like I'm looking down a lot of the day.
Yeah, so definitely for your neck, some suggestions I would make there is that number one, it looks like maybe the desk is slightly too high for you, because your shoulders look like they're coming up. So if there's a way to maybe elevate the desk, or if that's not a possibility, you can take that cushion out from your chair.
Uh-huh.
The other thing I would suggest is that you probably should be looking straight ahead. So any slight deviation of looking down, even the most minute deviation, is going to cause more neck pain. So you may want to put like a book underneath the laptop to raise that up a little bit so that you're seeing straight ahead rather than looking down.
Okay.
And then how about, and your neck, that just started, right? That you said
Yeah.
that's new.
Yeah, just today.
So when did that start? Was that today?
Yeah, today.
Okay. So the other thing I would say, in addition to making the changes to your desk, is that you may want to use some ice, and do a home make up a bag of ice at home, just using like a garbage bag. You put some ice from your freezer in there, tie it up, and you can put it right on your skin where it bothers you. And doing that is better than using like a gel pack, because the ice, you can put it directly on the skin as long as you don't have any circulatory problems, and it will melt before it gives you any sort of frostbite. Whereas a gel pack can have chemicals in it, that can cause burns, or it may just not be cold enough for as long as you need it to be. Usually we say to do 20 to 30 minutes at a time, and you can do that every 2 hours for the first 24 hours.
Okay.
Okay. Is there anything else that bothers your back or your neck while you're at home?
No, I don't think so. It just maybe the lumbar support. I'll give that a try to see if it's helping at all.
Okay. Sounds good.
Well, would you be
Okay.
able to show me how I can make the ice pack?
Yeah, of course. So let's go into your kitchen.
And then I did have a question. So you said that I wouldn't be able to use gel packs. So are you talking about like these I wouldn't be able to use?
Yeah, so you can use that, but I just wouldn't recommend that. Number one, because you can't really put it directly on the skin because there may be some chemicals in it that can cause frostbite.
Okay.
So I would, you can use that, but it's much better to just use regular ice, because again, you can put it directly on the skin. You don't need any barriers for it as long as there's no circulatory problems that exist, and it'll melt before it gives you a burn. So I would recommend just regular ice from your freezer. Okay, so let's go ahead and let's make an ice pack. Go ahead. Do you have a white garbage bag?
Yeah, I think so.
Okay,
Let me
I'll
see.
show you how to make it here.
Like this?
Yes, perfect.
Okay.
So you want to take the ice from the freezer and put a good amount of ice in there so we can cover the whole area. Well,
Is this
yeah, a
good?
little bit more. There you go.
Is this good right here?
Let's see. Yeah, because since it's for your neck, that's enough there.
Okay.
So so you'll just want to take out all the air and then tie it up. And then what you can do is put that ice directly on the skin, right where the pain is coming from. Yep, and you can do it right on the skin. And so what may happen after about a minute is you may start to feel a little bit of tingling or burning. So if that happens and you can't really tolerate it, you can take it off for about 5 seconds and then put it back on. Take it off for about 5 seconds, put it back on. And that should start to subside and the tissue will get numb. And you want to leave it on for about 20 minutes. And you can do that every 2 hours
Okay.
for the neck. So, and then if your back starts bothering you, then you can put that right on the tissue for 30 minutes every 2 hours for the first 24 hours. Okay?
Okay.
You have any
Am I,
questions?
yeah, am I able to reuse this?
Yeah, if it's still frozen, you can reuse it.
Okay.
Yeah, that should be fine. As long as there's no puncture holes in the bag and it's not dripping all over, should be fine to reuse.
Okay.
Is there anything else I can help you with? Any other
No,
questions?
I think that's it. I'll see how the icing does.
Okay, and let me know. You know where to find me on this telehealth if you need me.
Okay.
Okay. Have a good day.
You too. Bye.
Okay. Bye.